Hi, I am Delane Cleveland, and in the past few weeks, the state of Minnesota has considerably ramped up testing for COVID-19. One of the healthcare systems that is offering that testing is Hennepin Healthcare. And joining me now via Zoom is Amy Sanger. She is the medical director of the clinical laboratory at Hennepin Healthcare. First, thank you so much for joining us and taking the time. So maybe we can just get right into it here. If you can talk about what has Hennepin Healthcare done over these past few weeks to ramp up testing?
First of all, thank you for having me. So we've actually had an extraordinary effort by our microbiology and molecular laboratory. We started testing March 30th. So we were one of the first laboratories, if not the first in the state, to start offering this testing. And we've continued to ramp up significantly over the past couple of months. So we're just expanding a lot. We're expanding the hours that we're testing. We're expanding our outreach efforts significantly. And so we're pleased to help serve our community and our patients.
Is it mostly in the metro area, or do you have statewide options as well?
We do have statewide, so we've tested, within the region. So as far as, Sanford Health, out through the Dakotas, a little bit into Iowa and Wisconsin. But primarily it's mostly been, especially recently with the National Guard efforts, it's been pretty regional and local.
Okay. Who should be getting tested?
Right now, it's primarily those that are symptomatic, have any symptoms that are consistent with COVID-19 infection. And we're also testing a lot of asymptomatic individuals that are in high, quote unquote, high risk areas, the congregate living facilities, jails, homeless shelters. So as of right now, that's primarily the recommendations for testing. It could expand into anybody that's asymptomatic. We also are testing, working with a lot of facilities that are trying to reopen their hospitals and clinics and want to make sure that their providers are not putting patients at risk. So we're starting to see those requests for testing come in as well.
What's the process like?
It's quite complex. We have a request that comes in, and we have a outreach manager that works diligently to make sure we get the proper information as to in terms of what type of volume would be seeing from their facility, if they need collection kits or swabs, if they need training via video to do the collection. And then we have to make sure that we have a registration process for those individuals so that we can then return the results via electronic medical record. So and we have different couriers that come throughout the day and do kind of large drop-offs of testing. And so it's definitely keeping us very busy.
One of the things I've heard the governor and the health commissioner, Jan Malcolm, talk about over the past week is the capacity for testing. They're getting a lot of people to be tested, but not at the numbers that they were hoping for. So what are you seeing? Are you testing as many people as you would like?
We definitely have extra capacity, and we always have. I think we've been a little bit conservative in the beginning, trying to follow the recommendations of the Minnesota Department of Health. And so we were initially could start and a capacity to do 500 tests per day, and we weren't seeing that volume. And now we have capacity probably to do 1,500 tests per day, and that will increase actually by next month with support of more additional equipment through the Department of Health. But right now, I think everyone's trying to follow the recommendations and at least get the high risk folks tested as much as possible. So we do have, I think a lot of laboratories have capacity to do more. We just need the support and technical staff and all of that to actually do the test. And technologists don't necessarily pop up overnight. So, and to do the training and competency within the lab, it just takes some time as well.
So what are the plans here maybe going forward? Do you see yourself or do you see Hennepin Healthcare offering testing in senior living homes or things like that. What can you tell us there?
Definitely. I think we already have, and we always have, supported testing and collection for our own, within our own county. But we're expanding that with the governor's orders and to do congregate living facilities. And our nurses trained the National Guard to do the collections. And then we're seeing, requests. We're taking a couple of long-term care facilities per day, and that volume could be an extra, 400 to 500 per site, depending. And then they're going to, excuse me, keep retesting those individuals every week. So we do expect it to ramp up, and I think we're trying to be across the region, fair about to make sure that everyone's able to do the testing.
Thank you so much for joining us, and we really appreciate you sharing your knowledge with us.
Absolutely. Thank you so much.
Find more local news stories at ccxmedia.org and follow us on social media.